This edition of Ask the Doc. I got a question from someone who's been dealing with carpal tunnel issues for the past 5 years and had 3 surgeries, and the problem is only getting worse. For those of you that don't know me, my name is Dr. Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning and long-lasting pain relief. All right, back at it for Ask the Doc. Just a quick reminder, if you have any questions you want me to cover for neck, shoulder, elbow, or wrist injuries, please send them in. All the information to do that is available wherever you're consuming this information. But let me read the question. It says, about 5 years ago, I started having issues with my right wrist that started with some numbness and burning. Eventually, I had trouble gripping or holding anything. I was originally diagnosed with carpal tunnel syndrome and given a round of anti-inflammatories and told to wear a brace for 6 weeks. The problem got worse, and I received 2 cortisone shots and did 6 weeks of physical therapy. The cortisone shot helped with the pain, but the weakness and numbness kept getting worse. The exercises and stretches from PT felt good when I was doing them, but the pain and numbness came back a few hours later. I eventually had surgery to release the carpal tunnel, and it improved for about 3 months. But surprisingly, I started developing it on the other side. Instead of going through the same process with the new side, I just opted to have surgery right away. It also felt good for 3 months, then all the pain came back. It's been 1 year since the last surgery, and now both of my hands are completely numb, and I can barely do anything with them. The only answer I get from the doctors is to do more surgeries or just start down the path of pain management, which is something I don't want to do as I'm only 38 years old. Any ideas of what is going on and if there's anything that can help me? Thank you so much for sending in that question. And I'm always sorry to hear when I hear stories like this. Unfortunately, they've become very common in the broken medical model that we have, where people really don't get any results. They just get surgeries and pain pills, injections, which only make things worse. So let's dive in and really break this down about what's happening and why I don't believe it's actually carpal tunnel syndrome, but something else. So hopefully you learned something new from the video and it can help you, or if you know anyone that it can help, you can share it with them as well. The first is just the problem with the diagnosis of carpal tunnel syndrome. In the medical world, especially to appease what's insurance companies, we have to have a diagnosis. And a lot of these diagnoses are just what I call junk box diagnoses that don't really tell us anything. And basically, if anyone has pain like in their wrist or down through their arm, we just default, oh, you must have carpal tunnel syndrome. It couldn't be any further from the truth. A lot of times there's other things going on. And in order to get to the root cause of what's going on, we must have what's called a tissue-specific diagnosis, and a carpal tunnel syndrome doesn't tell us anything. A couple questions that I like to ask when I'm evaluating a client that has carpal tunnel syndrome is, was there any accidents or history of trauma to maybe the elbow or wrist? What else do they do on a daily basis? Like, what is their job like? Are they sitting at a computer all day? Are they in some weird position? Are they doing a lot of repetitive overuse type of work? And then also I want to know, is there any history of neck or shoulder injuries and pain? These are key questions that I also want to know as well. And a lot of doctors, they don't even ask these questions. They just go, oh, you're having numbness and tingling in your hand. It must be carpal tunnel. Here's a medication. Here's an injection, here's a brace. They don't really dive into what's going on because unfortunately the system isn't prided on fixing your problem. It's really just giving you some relief for symptoms and kicking the can down the road. A big issue here with the anti-inflammatories is essentially the inflammation is the effect, but not the cause of what's going on. So when I see someone that has inflammation, a lot of times they call it like bursitis, especially in like the elbow or the shoulder. I'm really thinking like, why is that inflammation happening there in the first place? And a lot of times there's a problem underlying that's presenting with that as well. Now, bracing is okay in the short term. It does take some of the pressure off some areas, but it also causes problems to build up in other places. So while you might unload that area, then you might be putting more wear and tear in the elbow and the bicep and the shoulder as well. So it helps temporarily, but you're going to have to deal with other problems on the road. The brace is not actual treatment. It's really just a Band-Aid per se, and it's taking the pressure off somewhere, but it's going to go another place, and you haven't got to the root cause of what's going on so you can actually fix the problem. Next thing, cortisone shots. I talk about this in almost every video. all the time whenever people reach out to me. Cortisone shots are actually very dangerous. Yes, they take some of the pain away, but they don't fix anything. Let me make that clear. They take the pain away, but they don't fix anything. And now you lose the ability to know to stop when you're having pain. Pain is like our evolutionary way of building in to let us know there's a problem and we need to lay off it. It's very good and keeps us from continuing to load that area. If you take that pain away, you're going to damage that tissue a lot worse. And then the problem gets a heck of a lot worse as well. Now, physical therapy. The problem with physical therapy is the tissue itself, it isn't healthy. Yeah, it's not healthy tissue. So trying to stretch it, trying to put stim and heat and doing exercises on it, it's not healthy. It's actually going to make the problem worse. So it temporarily feels better, but it's not actually fixing the problem. Why does it temporarily feel better with the exercises and stretches? It's pretty simple. So think of your spinal cord, and in your spinal cord, you have these two pathways. I won't get fancy with the names and try to like say all these fancy things, but essentially you have these two pathways, and one senses like pain, and the other one senses vibration and movement. And what happens is when you do these exercises, you have these little things called mechanoreceptors, and they start to fire and they go crazy. And what happens is they actually block some of that pain so you don't notice it. The thing I can give the best example of is like when you jam your finger in a door, you shake it out like this. When you're doing that, you're just confusing that and blocking the pain. It's actually not fixing anything, but it's taking it away. That's why when this person did the PT work, they temporarily felt better, but didn't fix anything because the tissue didn't get healthy. So what's more likely going on with this issue? So what I think is going on is there's what's called a nerve entrapment of specifically what's called the median nerve. So what is a nerve entrapment? So you have your nerves in your body, and they start at the base of the neck and they work their way all the way down and go all the way down into the elbow, to the wrist, and to the hand. And nerves are built with about 15% of extra slack, like a rubber band, to keep them really, really healthy. What happens over time is you overuse your muscles around the area. Maybe you have a job with repetitive use. Maybe you had an injury and you develop this stuff called scar tissue. Scar tissue is like glue that gets inside your muscles, makes your muscles less flexible, makes them weaker. Over time, that scar tissue gets bigger and bigger, and eventually it gets stuck to the nerve. And it presents with things like numbness, aching, burning, and tension. And that nerve gets compressed. And a lot of times, where you're actually feeling the problem is away from where the real problem is. So people come in and they're having carpal tunnel injury, but maybe they never had any damage to the wrist. Maybe they never had any elbow problems, but they might have a history of like neck and shoulder problems. And what that's telling me is it's getting caught a little bit higher up. One thing I pride myself on in my system, the PEAK method, is like getting to a thorough and specific diagnosis of what's going on, because if we don't know what it is, we sure as heck can't fix it in the long run. So there's 3 spots where nerve entrapment can occur of the median nerve and present with a carpal tunnel-like syndrome. The first area is what's called your nerve roots at your scalene. So up in your neck, out of your spine, you have these different nerves that come out. You have like a C5, 6, 7, 8, and T1. In the median nerve, it actually is a part of C6 all the way to T1, so it can get caught anywhere up through there. So that's a lot of times where it first gets caught, and then you start to feel the tension a little bit further down. That's why I ask questions of like, do you have history of like neck pain, neck trauma, neck stiffness? Are you working on a computer all day looking down? It really gives me an idea of maybe the entrapment is occurring a lot higher up. The next area where that nerve can get caught is right on the front part of the armpit on a muscle called the subscapularis. And what sits on top of that is called the brachial cords. And a big portion of that median nerve occurs in there as well. And then it gets caught down there in the armpit as well. So a lot of times it starts up here higher in the neck, then it gets caught under there, and it's having to pull more in there to make up for the nerve entrapment up top. So then that nerve entrapment starts to make its way down and can cause issues further down in there in the armpit as well. Then there's 3 other places down in the elbow and into the wrist where it can get caught, all through this chain as well. The first one is this muscle that kind of wraps around in here on the medial part of your elbow here and wraps around and through there. It's called your pronator teres, and the nerve can get caught right there. And then a little bit deeper is another deep muscle in your forearms called your flexor digitorum superficialis, and it gets caught there as well. So like I said, it starts up here, then it eventually gets caught further down into the armpit, then it gets caught down through here. So things keep pulling more and more, and you're feeling the symptoms more and more further down, but they're coming from higher up. And then the last part where it will get caught is right in here in this ligament. It's called the carpal tunnel ligament. That's where most people go in and have a carpal tunnel release. It temporarily feels better, but they don't actually fix it. So the reason this client struggled a lot with this issue is because they kept freeing it up down here, but it's actually caught higher up. And a lot of these problems are actually presenting more of like a neck and a shoulder problem. And now all the hands are going numb. Everything is going numb. So it's telling me there's more of a problem in the neck as well. And it's not actually going down into the carpal tunnel, which is why this isn't getting better, why surgery didn't help, why it's getting a heck of a lot worse. So how would I go about treating this issue in my own clinic? Number one is we're going to go through a thorough and detailed injury history to figure out exactly what's going on. Because like I said before, if we don't know what the problem is, we sure as heck can't fix it in the first place. I'm going to ask more questions about what you do for work. If you've had accidents and trauma, neck issues, shoulder issues, elbow issues, I'm not going to just jump right into the carpal tunnel because I need to know a lot more issues from what's going on. The next thing we're going to do is a functional based evaluation. So we know exactly where that nerve is getting stuck. And then once we know where the nerve is getting stuck, we're going to use treatment using first a hands-on approach that gets proper depth and then tension into the nerve entrapment. And basically what we do is we have the client go into a shortened position, we apply some depth and tension across there, and then we have the client go through a full range of motion. That pressure and that friction in the right vectors really allows that nerve entrapment to break down and free up. Then we're actually able to go into the forearm, into the middle part of here, and down into the carpal tunnel as well. And we use what's called an instrument. And an instrument basically goes in there and removes some of the fascia and the muscle that's getting stuck to the nerve very, very effectively. And it just works better because it's not that deep. And a lot of times if we try to use our hands, we can't get that optimal tension. The instrument does a really, really good job of helping to fix that problem. And then lastly, we look at modifications of maybe your workstation, your posture, and your workouts to assure that this problem doesn't come back. But the key is knowing exactly where to go, how to find it, how to fix it, because you can't fix a problem if you don't know what it is in the first place. And everyone out there just assumes, hey, you got numbness and tingling in your hand, it's got to be carpal tunnel, and then they do surgeries, they do injections, they do braces, they send you to physical therapy. Your problem doesn't get any better. It gets worse, and it causes bigger problems down the road. So if you've been dealing with carpal tunnel syndrome, probably diagnosed incorrectly, for I'd say at least 6 months, you've seen lots of other providers, you've gotten no pain relief or improvement in function, then reach out directly to us and get set up with a peak method trained provider to get some real answers about what's going on and on the path to functioning and feeling a heck of a lot better. All of the information to do that can be found directly on our website, and that is linked up wherever you're consuming this video. I appreciate you guys watching, and I'll see you on the next one. Bye.